Experts is recommending a big change in how millions of Americans use aspirin. They're asking doctors to stop routinely prescribing it to people over 60 and also for people at high risk of suffering their first heart attack or stroke. Taryn Arula has more in today's Medical Minute.
After years of recommending low-dose aspirin to prevent a heart attack or stroke, the U.S. Preventive Services Task Force has changed course.
Based on the latest evidence, we now recommend that people 60 years and older should not start to take aspirin because the harms cancel out the benefits.
Dr. John Wong and his colleagues say those harms could include internal bleeding that can be fatal, saying now don't start taking the drug if you're 60 or older and have no history of those conditions. The recommendations do not apply to those who have had a heart attack or stroke and are taking daily aspirin. For adults in their 40s and 50s who are at higher risk for cardiovascular disease, but with no history of the disease, the panel recommends they take aspirin only if their doctor advises taking it. Low-dose aspirin is commonly used as a pain reliever, but it is also a blood thinner, which could prevent heart attacks as it reduces blood clots. The about face could affect the daily lives of millions. Doctors with the National Institutes of Health estimate 29 million people who do not have heart disease are taking aspirin every day for prevention, and of those, almost 7 million people do so without a medical recommendation.
We're asking patients who are concerned about having a stroke or heart attack to have a conversation with their trusted clinician.
I'm Dr. Taryn Arula, CBS News, New York.